All right, well, we can go ahead and get started. I want to welcome everybody to our session. We're going to be talking about advocating for genetic testing, treatment, and insurance coverage. My name is Shannon Bennett. I have a daughter named Kenzie with a rare genetic condition called MCAP. I know from experience that obtaining genetic testing, treatment, and insurance coverage can sometimes be a real challenge. So with me to talk about that today are Chris Buchek and Laura Bedinger. Chris is an RN and a coordinator for the Children's Special Healthcare Program at the Kent County Health Department. But she also has an adult son with a rare condition, and she's going to share their story with us tonight. Laura is a genetic counselor who actually helped Chris and her son through the process of genetic testing, but she also supports a lot of other families and helps them advocate for testing and insurance coverage. So she's going to share some information that I think many people in the rare disease community will find useful. Feel free to type your questions in the Q&A box, and we'll answer those at the end of the session. And with that, I will hand it over to Chris.
Hi, everyone. Hope you had a good day today and had a little bit of sunshine. That's always good. So as Shannon said, I'm a mom, and I'm also a registered nurse, and I've been at the health department with the Children's Special Healthcare Program for over 26 years. So I work with families with kids with all kinds of different medical conditions. And I think what helps me the most is having a son that has special needs. So my oldest son, his name is Ricky. He was born with, he actually had a kidney anomaly that had to be, he had to have an operation. And at the time, we didn't have, anyway, I had to go over to Detroit. It was not a fun delivery and stay. And so he had surgery on his first day of life. And when we left there, they said, oh, take your son home. Everything's going to be wonderful. Well, by 10 months, he was not sitting up. And so at one of the well child checks, the pediatrician sent us to a neurologist, and he did an eval, and he said, well, we're going to call this cerebral palsy. And so, after that, I don't even remember getting home. If you're a parent, you get a diagnosis, it's kind of, you have all kinds of different emotions. And so anyway, Rick was pretty hypotonic. He was later to walk and talk. And he, so that was at 10 months when he was diagnosed. And then on his first birthday, he had a grand mal seizure. And that was interesting. And then he started in special ed early, like probably by 11, 12 months, he was already in special ed. And then he went through school, and he was in a campus-based program. He was SXI classroom, and he's pretty delayed. When he was younger, he could walk pretty good. Then he had more difficulty as he got to puberty. So by the time he got to be 15 or so, he started having these different kinds of episodes. We didn't know if they were really seizures or what they were, because he would either drool, or he'd get very weak, or he'd fling his arms, but he was conscious through the whole thing. So many visits to the neurologist. This is so different. I took videos, I showed them the video, and they're like, oh, that's interesting. It doesn't quite fit into any box neatly. And so the neurologist, when he was around 15, sent us to Mayo when he had a workup there. And they felt that perhaps he had some kind of a movement disorder. But he had a muscle biopsy and nothing else really came back at that time. So that would have been, I don't know what year it is. So that was probably in the 90s, I think maybe 94. So anyway, I should back up and say too that all along this time, people would say cerebral palsy is kind of like an all-encompassing type of diagnosis that they just gave a lot of people. And that he probably had some kind of a syndrome that we just didn't know what it was. And I believed that all along. I thought, yep, that's okay. But it was fine because you just do what you need to do for your child, and help them with school and whatever it is, help them to be the best he can be. That's what you do as a parent. And so anyway, the male thing nothing really came out. We had him tested or assessed for Marfan's, and we had some genetic. We had a visit to the genetics when he was, I'm not sure what year it was. He was still younger, probably like 15 or 16, where they didn't have the testing that they had today. And that's, I think, where they thought maybe Marfan's, because he's kind of tall and skinny and gangly, and especially as he was going through puberty, his fingers look really long. And but anyway, that came back, nothing, no Marfan's. So then, we just went about life, and I went about working my job at Children's Special Health Care, and he would occasionally continue to have these different episodes. He never really had any classic seizures where he would lose consciousness at all, but this whole time, since he was an infant, he was on seizure meds that whole entire time. So now he's older, and like I said, we lived our life, and we're living our life, and he got out of school, and he has some supports at home. He lives with me, and in my job at Children's Special Health Care, I see a lot of medical reports. That's just part of what I do, because kids have to have certain medical diagnoses to be on the program. And if your child has one of these rare diseases, chances are they could probably be on the Children's Special Health Care program. So anyway, I was reading a report, and I thought, wow, this sounds like my son. It was a genetics report, and this person had something called Glut1 Deficiency. So I thought, well, that's interesting. So I read more about it, and I thought, some of those things sound like Rick. So this was about the time of the first rare disease day, second rare disease day. And so I was a presenter talking about Children's Special Health Care and insurance. And I just happened to be, Dr. Bupp was walking me to where I needed to go to my room to present. And I said, hey, do you guys ever test older people? My son's 35. I've read about this Glut1 deficiency. I wonder if I don't know, that or something else. We think he has some other thing going on. And so he said, sure, make an appointment. So we did. And we started on the journey with the genetic testing. And I think the first thing we had was, you go through a whole history. I worked with Laura, and I tell you, she was awesome, because she would talk and help you really understand everything that was possible or probable or not, and very informative, very educational. I think the first testing we had was the microarray, and that really didn't come back with anything. And so then the next test after that was the exome. Is that what it's called, Laura?
Yeah, that's right.
So that was amazing. And that whole time frame probably was over the course of a year. And I should backtrack and say that in between those, especially in between those two tests, of course, the insurance doesn't want to pay. So, and in Rick's case, he had private insurance, and then he also had Medicare and Medicaid. So Laura, bless her heart, I don't know what they do, some kind of voodoo, that she works, and they have a way to work with the insurance company with the medical necessity letters. And they were even willing to write the letter to the insurance company on our behalf, which was fabulous, because as a parent, and I work kind of in this area, and that would have been hard for me to do. So that was awesome, because they could put all the medical information in there, and the testing was approved, which, the testing is very expensive. So that was really a cool thing. And I know from Children's Special Health Care and Medicaid, they don't normally just pay for genetic testing. They don't. it has to be prior authorized and there needs to be reasons to do it. Is it going to affect the treatment? So there's rules around that. Laura probably, she knows because they're the ones that troubleshoot all that in the background. So what was, I think, really cool about after that exome, guess what? It comes back as Glut1 deficiency, which is just crazy. So what it is, it has to do with the gene. It's the SLC2A1 gene, and it has to do with not having enough of the protein that moves the blood glucose into the brain to help the brain do what it needs to do and develop. So if you don't get enough glucose to the brain, you're going to have delays, which explains a lot of the delays that my son had. A lot of the kids now that they find kids with it younger, they put them right away on the ketogenic diet. Well, so we talked to the ketogenic diet people, and that's not going so well. And you know, my son's 37 now, and that if you know about the ketogenic diet, it's very, very restrictive, especially of carbohydrates. Well, that's one of the things he can do and he likes is eating. So I kind of struggle with that. Like, am I really hurting him? Because I'm not right now doing this ketogenic diet. But I do have hope that there are other trials coming because there's so much going on in the whole genetic field right now. And I would say from when I got the report back from the whole genetic testing, we went back into the office and Laura really went through everything. And this, I just want to show you. There's like all these pages, and it actually has all of the different genetic testing and whatnot that it shows. And I'll tell you what I think was really impressive to me and the most helpful is they actually have a spot in here that actually listed different resources that were specific to the Glut1 deficiency. Like one of them is the foundation, and another one is you can sign up so that if there are trials or research on that particular gene, that perhaps you can get into a trial if they're looking, if you fit the certain criterion, blah, blah, blah. So I went to that site and filled all that out so that hopefully something will come up in the future. I also wrote to the Dr. Pasquale from, I think he's at Baylor in Texas. I point down Texas South. And just said, hey, you know, I've got this 37-year-old son. If you need to, I'll bring him to you, you know, or whatever. So I'm really looking forward to the next time they have a Glut1 deficiency meeting they were doing, or a big conference. They do them once a year somewhere in the US. Well, of course, COVID, they didn't have the one. It was supposed to be in, I think, California. So I plan to take Rick to that because I think it'll just be interesting, especially to meet the families with the littler kids. Although at the same time, you know, I think he's maybe more delayed than some of the kids are that I've read about. So, but still, I think it's really cool that this is even the opportunity in the world that we live in that we can connect. There's a couple of really cool parent support Facebook pages that I'm on. Most of the people are younger, but it's really neat that you can connect to other people that are in the same kind of thing. Supposedly with this Glut1 deficiency, they're saying that there's maybe 500 cases around, but they really think that there's a lot more. I would guess probably a lot of those people that were diagnosed with that CP diagnosis way back when, maybe some of them have that as well. That's just my theory. So, but you know, sometimes my theories work out. I don't know. So I think that was the main points I wanted to say. Oh, I know. With that whole thing, once he was diagnosed, and I was reading more about it, it said that adults tended to have less seizures. So I talked with the neurologist and I said, why are we giving him this seizure med when he's not really having seizures? He's having these other movement kinds of things. And so we weaned him off and he hasn't had any classical seizures. So he's not on any medication now, which that to me was a huge, huge win because he had to have liquid because he can't do a pill twice a day and all, you know, it just kind of runs your life. So that was really nice to do away with that. So we're making some progress
Oh,
still at this age.
that's awesome to hear. I didn't know that. That's wonderful.
Yeah.
I have to say, Chris, thank you so much for like sharing that story. And I think it just highlights so much of can be a common journey for a lot of families with rare disease is seeing so many specialists going through many types of workups, getting different names to what your diagnosis might really be. And sometimes it can be a long journey. I have to say, though, massive respect to your savviness to pick up that Glut1 deficiency, because I remember you had mentioned it, and I thought, oh, yeah, it's on the list. It's on the list of possibilities. And I was like, this could be something else, though. We should do broad testing. I want to keep an open mind. And I was pretty surprised and also pretty excited to see that your instincts were absolutely right on. And that was ultimately the diagnosis. I would say there are probably a couple takeaways that I think about with your story. And one is there is never a wrong time to consider genetic testing. And I think the other is access to genetic testing and the type of testing that's available continues to evolve. This bottom line, this landscape is always changing. So if you're a parent or a provider, or maybe even a patient with rare disease, and maybe you went through this process years ago, I can pretty much guarantee and promise that it looks different today. And that's because there's a lot of factors that are kind of playing a role. My role as a genetic counselor, which I think Chris kind of highlighted a little bit through her story, is that part of this is I try to keep on top of this landscape, the different types of genetic tests that are available, the types of labs that are offering genetic testing. So you have to become really familiar with what options are out there for patients. So I don't know how many of you have had experience with genetic counselors through your experience, but we oftentimes are working within the rare disease community to help with counseling, coordination, research discussion, and really reviewing those genetic test results. So I think, Chris, in your case, we kind of just hit a really good window of opportunity to do testing for Rick. Like, I think we got that at no charge, if I remember correctly, just because the window of time and what was available at the certain lab just worked with his insurance. So we lucked out. But a lot of the barriers that I've heard over the years for patients that are trying to get genetic testing, and this is probably the biggest one, is a lot of people think genetic testing is going to cost you thousands of dollars. Like it's cost prohibitive to try to pursue this. Another big piece that I hear from a lot of families is, what is this really going to do for me? Is it going to change my management in any significant way? Am I actually going to benefit from paying for this genetic test? And will it even guarantee an answer or result? And I think really the reality is those are really good questions to bring up, because from my perspective, particularly for conditions where we don't know what the diagnosis is, like in Chris's story, we can't guarantee that genetic testing is going to find an answer, or that genetic testing is going to significantly change your management or change what we do for you on a day-to-day basis. Now, obviously, every story and circumstance is completely individual. So there may be cases where it does change your medical management. And there are times where, we might know more about the condition. Think like being able to come off of that seizure medication, even though that's a little thing, it's a big thing ultimately, because it changes a little bit of our treatment and management, makes it a little bit easier. But I think a lot of times, even if there's not significant, impactful changes, getting an answer can give you specificity. And that specificity can help you to understand the why. And I find the why to be really powerful for a lot of families, because it can help guide, what support groups you go to, or where you want to do your research, or maybe become someone who's involved in clinical trials.
or have you a better understanding for, are there risks in the future related to what's going on that I need to be aware of? And the other thing is it can really help to inform, is this something that could happen again? Is my mom, my sibling, my children, are they also at risk for this genetic condition or not? So there are benefits that sometimes the insurance companies may not see, but I think on a patient level, we do see that there can be a lot of benefits through going through the process of genetic testing. But I think what I want to spend like the majority of my time on is talking about the one big barrier, which is insurance and cost, right? Those are the big things that a lot of people think about and why they might not even take the first step into doing genetic testing. So when we are in the clinic, I really do try to prioritize, and I know this is true for really most of my genetic counseling, if not all my genetic counseling colleagues, is that we try to prioritize, what test is going to work best for that patient, not just on a technical methodology method where we're getting a robust test for that individual, we're getting good coverage of what we need to test. We also want to make sure that we know what the cost is, because I don't want to burden a family with a cost of genetic tests that might outweigh the perceived benefit of getting that information. So we do our best to try to get a sense of what that cost is before we order the testing. Because I don't want to hear stories of, I did the test and it cost me thousands of dollars. Like, that's what I'm trying to avoid, right? So very typically, we do, as Chris was saying, we submit prior authorizations. That is not on the family to do. We'll write letters of support, particularly if we feel like genetic test is going to significantly impact medical treatment or management. We will bring up our arguments for why the insurer should cover the test. And the other thing we do is we try to determine which lab is going to fit best with your insurer. So there are a lot of steps that go into this. And the reality is there's not one genetic test that tests for everything. And the genetic test that I offer for one person may be different for another. So there's a lot of variability within everything that I'm saying. But overall, I will say that the access to genetic testing has significantly increased. And I think Chris's story highlights that. You had that time where you went to Mayo Clinic and had some genetic discussion with Marfan syndrome, and there wasn't really the type of testing that we were able to offer later offered at that time. And I think that just demonstrates this is an evolving landscape. And the big reason for why this is something that is more accessible is because technology has improved. So our ability to test for more and cheaper is way better than what it used to be. And as a result, we've seen an increased number of labs offer genetic testing, which increases competition, which increases demand, and ultimately that drives down the cost of testing for consumers. So even in cases where your insurer, even though we might say, we really want to do testing, we've written our letter of medical necessity, we've explained why, and your insurer may still deny that genetic test, even in those cases, we have options and a lot of families for doing genetic testing. And there are a couple of reasons why we still have options. One is there are self-pay options for lots of types of genetic tests. And self-pay tends to be cheaper than the cost that they would bill your insurer. So if your insurance denies it, maybe we can do it at a self-pay price that's discounted, essentially. A lot of the labs that we work with too offer financial assistance programs. So they use the federal poverty guidelines. And if you meet the criteria, you might get a significant reduction on the total cost of your genetic tests. So that's a really great option. And many of these labs also offer like a monthly payment plan. So you may not be responsible for paying the full cost at one time, but I could actually stretch it out over a year and pay on a monthly basis. And the reality is, as I mentioned before, with these increased number of labs, that means that we can shop around. And shopping around is good because it allows me to kind of compare costs for different labs. And, of course, I'm making sure that the tests that I'm comparing are going to soundly look at the genetic material we want to assess. But we do a little bit of comparing, especially when we're not sure what's going to be the best cost option for a patient. Let's say it's the same test. One lab might offer it for $450. Another lab might offer it for $300. I'm going to offer you the $300 option, right? So this is kind of part of being aware of what's out there and talking with representatives from these different labs to kind of be on top of this landscape. And I think what's really exciting too is that I'm seeing an increase in the number of sponsored tests that are being available. This is somewhat newer. This isn't a research thing, it's actually commercially available. And essentially what's happening is patients can get certain types of tests at no charge to them because it's being sponsored oftentimes by a third-party payer like a pharmaceutical company. So the company is paying essentially for the cost of the test, and then they get de-identified information as a result of paying for that test, but patients get the test for free. So there's a sharing of information that happens to have that testing done at no charge. The reason that they want that information is it helps build up their database. So it's not going to lead back to you. It's not going to, share your name, your date of birth, your zip code, any of that, but it just gives your genetic change and the types of features that you had that qualified you for doing that sponsored panel. And that data will hopefully help drive our understanding of these unique genetic changes. And from those pharmaceutical companies' standpoint, can we use that to better understand these conditions to develop drugs and therapies that will target these genetic conditions more specifically? So this isn't available for every condition, but I am seeing that these options are more and more available, and I'm hoping that that's something that will continue to expand for our families as well. So overall, kind of using all of these different factors, we usually can find a way to get testing done for patients. And I'll be honest, there are times when there are still barriers. And I run into this a lot of times, particularly when we're pursuing a genetic test that may require a unique methodology that isn't offered at a lot of different labs, or is just a little bit more labor intensive on the lab's end to complete that genetic test. Patients that are in that category, we're going to be working harder to try to get that down to a cheaper cost. The reality is they might be paying more, honestly, for that genetic test. And there are other types of tests that are sort of on the forefront of where genetic testing is moving. Things like whole genome sequencing, where insurers just haven't yet come up to the table to recognize that this could be a really impactful tool for, diagnosis for patients. So that's something that, even though it's technically available, I really have difficulty getting that testing done for patients on a commercial level, unless they're paying like a self-pay out of pocket for that test at this time. But I think like what we've been saying through this whole conversation is this is something that continues to evolve. So I will see improvements, and I feel confident in that. But I think ultimately, if we do get to those barriers, keep in mind we have research options too. So there are a lot of different research groups that may offer the opportunity to do genetic testing. So that's something that I always keep in mind. It's not my first option, because when you go through a research route, a lot of times it doesn't guarantee that you're going to get back the result of the genetic test, and they're in no rush to get that information out to you. So unlike going through a lab that's doing this commercially, they have a turnaround time that they'll guarantee for you. If we go through research, we might never get back results for that genetic test. So it is something that we can do, and we certainly offer for patients, but it's probably the last option that I'll go to if I can't get tests within a reasonable range. But there are definitely some wonderful organizations that, for me as a clinician, I can apply for that patient to be involved in for this research group. There are ones that are patient initiated, things like the Undiagnosed Disease Network that's sponsored by the National Institute of Health. They offer really broad genetic testing for patients, for those that have had a long diagnostic odyssey without any diagnosis made. So all of this to say that we try to work to find options for getting past that barrier of cost with genetic testing. And I recognize like it can be really challenging as a parent and as a caregiver and as an individual with rare disease, because you are often in a position of having to advocate for so much and explain where you're coming from so many times with so many different providers. And I really encourage you to find the people who can help you and be a part of your team. So when you're thinking about wanting genetic testing or wanting to go through this process, our genetics team or genetics teams that are in your region are going to be extremely useful tools. And if you're not someone who's in like the Grand Rapids area, you can use things like findageneticcounselor.com, which is a resource that will help you find genetic counselors in your area or to access them via telehealth services. So there are a lot of counselors out there and they're ready and they want to help you. Just to kind of have to reach out and access those resources, just like with so many other things within the rare disease community. And I think that was kind of the big points that I wanted to hit on. Shannon, do you have any questions or things that popped up?
We do have a few questions. I just want to thank you both for sharing. I think that, Chris, your story was really great to hear. I think for a lot of families who maybe have a similar story or have an older child without a diagnosis. And I think, Laura, you shared a lot of really great information that even answered questions that I had. So the first question for you, Laura, is genetic testing beneficial to someone who has a diagnosis? And I think this is a really important question because I know for myself, my daughter only has a clinical diagnosis. We've never pursued genetic testing, mostly because of the cost, but also because she's the poster child for the condition that she has. And we didn't really feel that it would change the course of treatment at all. So didn't think it was necessary to pursue it. But for people that have that situation where they already have a diagnosis, is it beneficial to pursue testing anyway?
Yeah, that's a really good question. And honestly, it's going to very much depend on the genetic condition that we're talking about. But just sort of thinking in general, I do think if you're thinking about, is this something that I'm worried other relatives could have or be at risk for, then genetic testing is really helpful. So example would be someone who has a hereditary cancer condition. Let's say that they've developed cancers early on and there's a really prominent family history and their doctor feels this is probably a hereditary cancer condition. What's the benefit of you going to the next step of doing genetic testing? Well, in that case, I would say, one, we'd identify exactly why this is present. So the specific genetic change that's playing a role, which might inform specifically on risks. And two, if we identify what's going on in you, we could then do that same testing in other family members who may be at risk for the same thing. So if we know the cause, we can test for other family members. So that becomes a really good way for, genetic testing to be beneficial. But I agree, there are definitely cases too where I have a patient who comes in and they just hit all the boxes. Like you said, Shannon, for your daughter, and it's kind of like, okay, we know this is the diagnosis. So do we really need to take the next step to do genetic testing? In some cases, I'll say we really don't need to. In others, if it's a condition where there's promising research in, treatment based on your genetic change, that might be beneficial. There are patients in the neuromuscular world who have Duchenne muscular dystrophy. That's something that a neurologist could diagnose based on presentation and elevation of their CK. And essentially, for a while, we weren't doing genetic testing on those patients, back in the day. But we now know that there are therapies available for patients depending on the mutation within their gene. So that genetic information actually becomes really helpful. And in that condition as well, moms are a lot of times what I would call carriers for that condition. And so identifying that genetic change could inform mom's risk for being a carrier and even in moms, some health concerns that can be related to being a carrier for that condition. So I think this is a complex question to answer. And as you can see, as I'm walking through these scenarios, it really does depend. I hope that kind of helped.
It did help a lot. I thought that was a great answer. Next question is for Chris. As a parent who didn't obtain a diagnosis until Ricky was 35, what encouragement would you give to a family who's still searching for answers as their child ages and feelings of hopelessness sort of set in because they haven't found a diagnosis yet?
Well, I think as Laura had said, I would reach out to the genetics area where you live and see if you're able to, if that might be a piece of the puzzle, that might be something that you'd want to look at. I think it depends on the parent and how, I don't know, is it going to make a difference? I didn't know with Rick if it would make a difference, but I was just very interested in it. Some of the things just didn't fit. So if you really struggle with that, you want to try to get some answers if you can, So I would always encourage people to take that next step if that's what they'd like to do.
Laura, are there any things that you haven't touched on yet that any sort of encouragement that you give to families that are just striking out repeatedly and starting to feel hopeless?
Yeah, Shannon, I think that's a really good question. And it can be really tough. Rare disease is rare. And the reality is genetic testing is definitely evolving, and it's a lot more accessible and really successful for a lot of patients. But there is still a good number of our patients that we do the biggest tests, we do really comprehensive workup for them, and we still don't find an answer. So this is something that I will just say, you're not alone if you're in that situation, that a lot of families deal with, not getting a diagnosis. And I would also say that this is something that is a continued journey. I think Chris's story really highlights that, it took time to get to that diagnosis. And sometimes the technology isn't there, or our understanding of genetics isn't there, but it might be in 5-10 years.
Okay, next question is for Chris. You work for Children's Special Healthcare, so obviously you have a pretty extensive background in the insurance process and how that works. Aside from it obviously helping you learn about what a Glut1 deficiency even was, what other ways was having a background in the insurance process helpful to you as you navigated a new rare diagnosis?
Well, just knowing that if we were going to go for genetic testing, that there's a lot of things that have to fall into place to get that covered, or else to know what the cost is if if you're going to choose to pay for it. So you'd have to weigh that out. You'd always want to check into what the coverage is going to be, I think, before you're going to attempt any testing, because you don't want to end up with some big surprise bill afterward. And what Laura does is phenomenal. I mean, she just helps you right along the way to know, what the situation is. But I think in general, as Laura said, the insurance, I think, is getting a little bit better because of all the reasons that she said. But you want to make sure to look at that. You don't want to not look at the what's being paid for. And isn't that interesting? I mean, I was really thinking about when Laura was talking, and me too, and what we do every day. It's like, who knew that as a nurse or as a genetic counseling that you're going to have to know all this stuff about billing? I mean, you feel like you're a biller. And it's like, but at the end of the day, our goal is to help kids get the care that they need. And if you don't know how it's going to get paid for, they're not going to get the care that they need. So you have to be a biller. You hate it, but you have to be a biller.
Yeah, there is definitely an aspect of that. And I have to shout out to our team, because we have great genetic counselor assistants that definitely help with this process and getting the paperwork and orders sent out for us. And that's a huge part of, helping support the team.
From a family perspective, It's really helpful to have people with those skills, though, because someone that doesn't have a background in insurance, I can't tell you how many times I've called Chris. What do I do with this? How do I get this covered? What hoops do I have to jump? So although you may resent having to be a biller, I'll speak on behalf of families like mine. I'm glad that you do have those skills. Another question, what insurance companies are the easiest to work with for genetic testing? That's a really good question. Not that you want to put anybody on blast, but
I almost feel like I can't answer this question because again, I mean, it's going to depend on the genetic test that we're ordering.
Sure.
There's just not a perfect fit for one insurance is a perfect fit for all genetic tests. And, you know, the labs and what they're willing to accept is changing too. So Medicaid for a long time, very difficult to get, you know, broad-based testing. We're right now in a window where, you know, certain labs are accepting Medicaid regardless of authorization. And that opens up our ability to order that testing and not get back big bills for families. So it continues to change. I mean, as soon as I feel like this is the insurance that's great with genetic testing, it gives me trouble.
It's rapidly evolving. Yeah. Understand that. That was all of the questions that we had. So I again want to thank you both for taking the time out to share with us. And Chris and Laura will be hanging around for a little while yet. If you have any questions that you want to ask directly to them, you're able to do that. I thank you for joining our session, and feel free to pop around at the other things going on the Hoover website, and enjoy the rest of the event.